Okay, today we're going to be talking about nail theory. We're going to be talking about how the nail's built, how it grows, and all the diseases, disorders, and conditions. All right, the nail is an appendage of the skin. Appendage just means something that grows out of something else. So my arm is an appendage of my body. All right, the technical term for nail is onyx. So you're going to see that almost all of the diseases and disorders start with oni something. So that tells you, that's your clue that they're talking about nails in the name of what they're describing. Onychology, study of onyx, it's the study of the nail. Okay, here's the structure of the nail. So we have our mantle. Our mantle is just this flap of skin that covers up the structures underneath. Your nail matrix is underneath there, and that is the mother of the nail. So if your nail matrix is injured, your nail's either going to grow back distorted or not grow back at all. You've got your nail root, which is between the matrix and your nail plate. The bed, that's the part that the nail rests on, just like your body. This is the nail plate or the nail body. Your body rests on a bed every night. The lunula, lunar means moon, so the lunula is the half moon at the bottom of your finger. Eponychium, which is the skin at the bottom of the nail. Okay, your cuticle, we know what that is. That's the dead skin around the nail. Your nail grooves, they're like the train tracks that tell your nail how to grow. Your sidewalls, that's the puffy skin that comes up alongside of your nail. The perionychium, that's the cuticle along the sides. Your free edge, which is the white part of the nail, when your nail disconnects from your nail bed, that is what your nail actually looks like. Down here it's pink because you can see the nail bed through it with all of its blood vessels. And the hyponychium is the skin underneath the free edge. Okay, the nail's made up of keratin like the hair. So our hair, skin, and nails are all made up of keratin. Okay, nail growth originates in the matrix. Like I said, that's the mother of the nail, which contains lymph, blood vessels, and nerves. Cells are created and pushed outward from the nail root. How fast the cells are pushed outward depend on, that's what determines how hard and thick your nail is. When the cells keratinize or harden, they form the nail plate. So it's just like your hair. Inside of your body, your hair and your nails are both soft, and then they keratinize as they get to the outer portion outside your skin. And again there, how fast is the thinness or thickness of the nail plate. Okay, average fingernail growth rate is 1/8 inch per month for adults. So what that means is if it grew for 4 months, that would be 4/8 or 1/2 of an inch. And if you look at the average person's nails, that's going to be close to a lot of you. What it's going to take to grow completely out. You have much smaller nail plates than I do. So it just depends on how big your nail plate is how fast your nail is regenerated. Younger people's nails grow faster. Our nails grow faster in the summer, just like the flowers and everything else. It takes 4 to 6 months on average for a new fingernail to grow. Again, that depends on how big your nail plate is. As we get older, the growth of the nail slows, and it's affected by nutrition, health, and or disease. Middle fingers grow the fastest. Thumbs grow the slowest. Males' nails grow faster than females' nails. Interesting. Toenails grow slower but are harder and thicker. I'm sure you'll all agree with that. And it takes 12 to 18 months on average for a new toenail to grow. Much slower. Injuries to the nail can result in shape distortion or nail discoloration. So the more you injure the matrix or the nail bed underneath the nail, the more likely you're going to have a distorted nail when it grows back. Permanent distortions can occur if you lose the nail due to trauma, Okay, and then your nail bed or your matrix is injured, or if it's lost through disease or infection. Okay, so let's talk about diseases, disorders, and conditions. Onychosis is any disease, disorder, or condition of the nail. So if you go to the doctor and they say, you have onychosis of the nails, basically what they're saying is, I don't really know what it is, but I'm going to use this general term, and that covers everything. So there's two words that are short like this that start with oni. Again, remember that means nail. It's onychosis and onychia. Okay, and I'm going to explain to you how to remember onychia later on. So there's only two that are short. All the rest of the words are very long. Etiology is the cause of what created this problem. Is it systemic through your whole body? Is it environmental? Or is it related to disease? Okay, we went over this before. 6 signs of infection: pain, swelling, redness, local fever when your skin feels warm, throbbing, and pus. Okay, so when you feel people's hands, if their hands are very cold, they may have poor circulation. If it feels hot, it may be because of infection. Okay, the texture of the skin can indicate diseases and disorders, and inflammation on the skin or nails can indicate injuries or, again, poor circulation. The length and condition of the free edge. Are they nail biters? Are their nails dry and brittle? Okay, if they have stiff joints, you may have to be more gentle with your massage techniques. And the nail plate shape and thickness can indicate diseases and disorders, and we'll talk about that more as we go through each one of them. Okay, nail diseases. All right, the first one is onychomycosis or tinea unguium, and that's ringworm of the nail. Remember, if we say tinea manus, that's ringworm of the hand. Tinea pedis is of the foot, but tinea unguium is ringworm of the nail. Okay, I have an extremely weird story to tell you about onychomycosis that might help you to remember this one. So, back in the Vietnam War, the Americans were helping the South Vietnamese, and the Russians were helping the North Vietnamese. And back then, we would call Russians commies. That was pretty common. So remember commie, onychomycosis. Okay, and the conditions in Vietnam were very hot and wet. It was a jungle, and people had to really be conscious of keeping their feet as dry as they could, because all sorts of things would occur because of those conditions, including ringworm of the nail. So I want you to remember the commies fighting the Americans during the Vietnam War and people getting ringworm of the nail. Okay, tinea manus, just talked about that a second ago. Ringworm of the hand. Okay, you cannot work on people that have any of this. It's fungus. Okay, and they need to be referred to a physician. Tinea pedis, ringworm of the feet, commonly known as athlete's foot. Don't work on them with that one. All right, paronychia or felon. Okay, so we know that a felon is someone that commits a crime. Okay, so this felon that I'm talking about today is an arsonist, someone that sets fire to structures. And the way that they set fire is they start with a tissue. Okay, they set fire to the tissue and then they set fire to the structure, and that's what makes them a felon. Okay, so when you say this, the best thing to do is always pair these words up together. Paronychia or felon. Learn them together. Okay, so it's an inflammation, so think of those flames, of the tissues, this says skin, of the tissues surrounding the nail. So you can see it gets very red and very swollen. It is, again, something you will not work on that person, but this is the one that's kind of crazy. People that are dishwashers are the people most likely to get this. Okay, so prolonged exposure of hands to water can create favorable conditions for paronychia. So remember, you know, if I have an arsonist, the best way to take care of that is with water. So it kind of all goes together. Okay, onychoptosis. Okay, on this one I want you to remember the PT, which stands for physical therapy. Okay, again, another stupid story to help you remember this. So when I was in high school, my big toenails would fall off every year because I played basketball. Okay, so what I want you to remember is you're being sent to PT, physical therapy, and what they want you to do is they want you to play basketball, and it's going to cause your nails to fall off. Okay, mine fell off due to trauma. My shoes, my toes pounding into the tip of my shoes were causing that. But this is a disease. It can be injury related also. All right, it may occur on only 1 or 2 nails like myself. Okay, no service may be performed on the affected nails. Okay, here's the other little short one, onychia. So when we're cutting hair, a lot of us cut ourselves. Okay, we get crazy and we cut ourselves with the scissors. This time we're gonna be really very clumsy, and we're gonna nick our finger right here, right past the nail, which has our matrix underneath it. So I want you to think of you're nicking your skin right over top of your matrix with your scissors. Okay, so it's an inflammation of the nail matrix. So I nick it and it gets infection in it. Okay, so it's actually of the nail matrix. No service may be performed. Okay, onychotrophia. The word atrophy is just a general word that just means something gets smaller and smaller and smaller. Okay, so if you don't use your muscles, something happens and you end up in a wheelchair. And you've seen people that their legs get smaller and smaller and smaller. It's because their legs are atrophying. So it's wasting away. It's getting smaller. So wasting away of the nail. It's from injury or disease. No service may be performed. Okay, onycholysis. When you say this, I want you to say onycholysis, onycholusis, lysis, lucis. It's a loosening or separation of the nail. You can see here where this nail is white on this picture. It has all separated from the nail bed. That's why it's white, but it doesn't fall off. Okay, again, do not work on this. Okay, now, nail disorders rather than diseases. Okay, blue nails. Okay, this one's easy. You don't have enough circulation. So the person might have a heart problem, poor circulation, or injury. Okay, you might suggest them seeing a physician if they're unaware of why it's blue, and just be gentle with it. Okay, eggshell nails. Okay, thin, white, and flexible. Now I know an eggshell isn't flexible, but think of what it looks like. It's thin and it's white. Okay, so in eggshell nails, you can bend them very easily, and you have to be gentle with these and maybe put a nail strengthener on there. Corrugations. It's horizontal ridges across the nail, so it goes side to side, okay? So remember our corrugator when I talked about that. Remember that corrugated cardboard that goes like this. Okay, so you've got a wavy ridge going across your nail. Okay, it's going to be probably from injury, or there could be, you were very sick at one point, and so it grows out like that. If it's an injury, it'll probably grow out. If you've been sick, it may cause permanent ridges. You can buff the nail, or you can put a ridge filler in to help level out the surface of the nail. Okay, next we have conychia or spoon nails. Instead of the nail growing like this, it's backwards. You can see that the sides are coming up. Okay, so the way I want you to remember this is, in the morning, I can eat my Special K cereal with a spoon, okay? And it indicates a long-term illness. File carefully, don't put any pressure, and use polish to harden and protect the nails. So just be careful with this one. All right, furrows. These are very common. These are lines that go vertically. I've got furrows all over my nails, everywhere you look. It's the injury to the matrix that causes the cells to reproduce unevenly. Okay, so I keep pounding back here on my matrix when I'm working on things, and therefore everything grows out unevenly. The older you get, the more you get these, just from life, from injuring this area back here. So you can buff it, apply a ridge filler to even it out. Okay, onychogryposis, an increased curvature of the nails. Okay, there's a picture there, but what I like to think about it is that the nail grows wrapped around the end of my nail like this, around the end of my finger. So I think of it gripping my finger because it does, it has an increased curvature. Okay, look for any signs of infection, clean well under free edge, keep nails short. Okay, the shorter you keep them, the better they'll be. So think of that gripping. It's gripping the end of my finger. Onychocryptosis. If I have an ingrown nail, if you've ever had one, you know that it makes you want to cry because it hurts so bad. All right, so you're just going to trim it, refer them to a physician if need be. Melanonychia is a brown or black darkening of the nail. Okay, so you can have a systemic disease. It could be medication. You can see the increased melanoma, or the increased melanin rather, in the nail, which could be melanoma. So that's something that you may want to refer them to a physician if a physician hasn't seen that. Basically you can perform a service as normal. Onychosis or hypertrophy, say these two together. So if something is hyper, it is too much. So you have a thickening of your nail plate. It gets very, very thick. Again, this is something very common in older people. You can buff it to even it out. That will make it much better. Okay, nail conditions. So hangnails or agnails. So they're the same thing. They just took a couple letters out, and it's when the skin is splitting around your nails. We're all familiar with hangnails. Bruised nails or splinter hemorrhages, when you hit your hand inadvertently and it gets blood underneath your fingernail. You have to let it grow out. The best thing to do is go to the hospital and let them put a hole in your nail, and it lets the blood out and it stops hurting immediately. Okay, and it doesn't hurt you at all. They never get to your skin. They just go through the nail. Okay, leukonychia, we talked about leu always means white. So you have white spots appearing in the nail. It's just an injury. Okay, no big deal. Pterygium, okay, that's when skin becomes attached to the nail plate. So it can happen underneath here, underneath your hyponychium. It can also happen down at your eponychium. So you just have to be careful with that, because if you are jamming an orange wood stick underneath there to try to clean under the free edge, and that's living skin that's attached, that will hurt very much. Bose lines, okay, similar to horizontal corrugation, so it goes this way. I don't know why they don't have a picture there. There's a trauma or illness, and it says uncontrolled diabetes or pneumonia. Nail returns to normal after trauma. Okay, onychophagy or onychophagy is the wrong way to say it, but if we chop our nails off, we bite them off with our teeth. Okay, so it's just a nervous habit. So get people in getting their manicures, maybe transition them into acrylic nails, and that will quickly stop that habit. And onychorexis. Okay, if we core an apple, we take the middle out where the seeds and everything are, corexis. Onychorexis on a nail, imagine there being a split in the nail, split or brittle nails. So just imagine a piece of the middle of the nail being removed, just like when we remove the core of an apple. onychorexis. All right, true or false? The cuticle is dead tissue around the nail? True. If nail conditions are present, a service can be performed with modifications. Okay, that's just a condition. It's not a disease. It's not a disorder. The lanula is the visible part of the matrix. Okay, generally we can only see that on our thumbnails for some reason. The nail plate is made up of cells that have keratinized. They've gotten harder. Cell production in the matrix determines the thinness or thickness of the nail plate or nail body. For a new fingernail to grow, it takes approximately 4 to 6 months. If nail disease is present, the client must be referred to a physician. A healthy nail is smooth, curved, and without hollows or wavy ridges. A bacterial infection around the nail is paronychia or felon. Remember that inflammation of the tissues surrounding the nails. Remember, our felons set fire to tissues. And eggshell nails are thin and can be hereditary.